Hello and welcome to Over the Hill Health. And today we're going to talk about a really important subject, and that is how to treat your friends or family members that have just been diagnosed with cancer. Now, having worked in radiation therapy for 10 years, I'm going to give you the advice that the patients told me. So this advice is not just coming from myself, but from 10 years of talking to patients working in that dealt with cancer. And so I want you to understand what the most important things are to people who are facing the diagnosis, a new diagnosis of cancer. If it's a younger patient, they have already scoured Google, talked to their doctor, and gotten all the information they wanted and can actually handle, they're actually on information overload. If it is a younger patient, and I'm not talking about child here, okay? If it's an older patient, more toward retirement age, a lot of times they don't want to have that much information. They really just want to talk with their doctor. So my first piece of advice is don't give too much information or any information to patients that have been diagnosed with cancer unless they request it from you or are interested in it, because they are already overwhelmed with the diagnosis. And if you come along and give them 80 pages that you printed off the internet of things they need to do, they just can't do that. It's overwhelming, okay? It doesn't help them. The mental aspect of fighting cancer is just as critical, if not more so, than the physical treatment that they are going to be receiving, whether that be in chemotherapy, surgery, radiation therapy, or a combination of treatments. So you need to first become supportive. And what does that look like? Because it's a broad term. Supportive is not giving information to a family member or friend. Support is actually just telling them that you are going to pray for them. You're going to give them uplifting material to read. Maybe you can share positive podcast with them. Maybe there's some music that you know that they like. You need to find out the interest of the person that you're dealing with so you can know how to be supportive of them. Find out what their hobbies are. Find out what motivates them. And then you need to provide those tools that motivate them as much as possible. If they're religious, then you need to take time out of your day and pray with them. Just give them a call. You can pray over the phone. You can stop by and give them a quick visit. You don't have to make visits long. You don't have to make visits intense. You just have to let them know that they are on your mind and on your heart and that you're keeping them there. You can tell people that you've added them to your church prayer list if they're religious, and they will appreciate these kind of accolades to them when they're dealing with cancer. What if someone is non-religious? That's okay too, friends. It's not like every patient that I had sit in the chair was religious. So other things motivate people, such as family, such as reading material, such as music. And it's important to find these subjects. I always let patients lead me on the subjects where they wanted to go. Sometimes I would have patients that did not want to speak, that just was kind of dealing with it quietly. I don't have to say anything. I can show a loving, kind, supportive hand and a tender regard without having to get into a conversation. Other times people want to talk, and so you mainly just need to listen when someone is faced with a diagnosis. And then just do. You see, a lot of times when you're overwhelmed with information, you don't know what to ask for anyway. So, sometimes it's best just to do. What do I mean by that? Well, if you're saying, I don't know what they like or I don't know what they want, it doesn't really matter. Bake a loaf of bread, bake them a batch of healthy cookies, drop by something you think they might enjoy, drop off a CD, give them tickets to a baseball game or to a local concert. Just do that without asking them because they're already dealing with information overload. what you can do is set a calendar on your phone for either a family member or friend that you can spend just a couple minutes either giving them a quick call or writing them a quick note and dropping it in the mail just to let them know you're thinking about them. Now, if they're religious, you can of course add religious text. If they're non-religious, don't push religion on them. Show religion to them if you're a religious person. But it doesn't matter where on the scale of beliefs you are, because the needs for humans to feel loved and accepted, especially in times of intense trials and tribulations and difficulties in their life, the need of all of us is the same, and that is for someone to love and truly care for us. And so when you're dealing with someone that has been diagnosed with cancer or going through cancer, that's what they need to feel the most, is that you're giving them your support no matter what choice of treatment options they are choosing. Because some people may choose a complete natural path, and you may be completely opposed to this as a family member. But keep in mind, it's not your choice and it's not your body. It is really their choice and it is really their body, and they have to choose. So instead of fighting with them about what they should do, go ahead and give them support and say, I'm with you 110%. I am with you there to support you. And that's going to do more for them fighting off cancer than any other amount that you can do. Because if you get their brain on a level of they've got support, they've got help if they need it, the brain then comes into a fighting mode that someone's in its corner and is going to be able to fight off disease. Cancer is a disease, and the immune system can fight it to some degree. And there's been amazing instances where the immune system has completely eliminated cancer. That doesn't happen in every case. Those are odd cases. But the best thing you can do for a cancer patient is to give them that ability to fight. And the only way to do that is not with information, but with a kind, tender spirit, and letting them know that you're in their corner through thick and thin. Because sometimes their looks are going to change. I'll tell you one story. I remember it wasn't that long I had been working. I did all the diagnostic CAT scans, follow-up CAT scans, and I did the markings for the radiation therapy for their treatments. And so I remember one time a patient was coming in for markings, and I had just started, and it was a young lady, and I had turned around to prep something on the CAT scan machine. When I turned back around, I didn't realize it was the same person that was in the room. In fact, I was probably caught off guard on my face because, the person had removed their hair, their teeth, everything, and I didn't recognize. I thought someone else had stepped into the room. And so at that moment, I began to realize what people need is someone that cares and loves them no matter how they look. No matter if they lose their hair, no matter what happens, they need someone in their corner, because that's going to matter the most. And I'm going to tell you, when you walk out on the street and you see people looking maybe wealthy and dressed up, and maybe they have an attitude with you that day, they may be fighting end stages of cancer and you have no clue. Okay? No clue. Give people a really long runway of leeway when they are diagnosed and when they're facing this. Be patient with them. Be in the listening mode. Be in the supportive mode. And you're going to give them the best chance of survival. Please take this to heart. This is a really important message. And if you find this video of value, I urge you to share it with family members who are facing this. Because it does not matter how much information you give somebody if they do not feel the love and support from you. It's worthless at that point. So it doesn't matter if it's your wife, it's your mother, if it's your grandparents. They want to know that you love them and that you're there for them. I hope you've enjoyed this this episode on Over the Hill Health. If you haven't subscribed to the channel, I urge you to do so. Share the channel. I'm going to be adding a lot more important content over the next coming months, and I really appreciate your support. And until then, we will see you in the next video.